What do cannibals eat to freshen their breath?
I don't know, Beau.
Mentos. Get it? Yeah. So we're talking about not toes or men's toes or Mentos. We're talking about metatarsalgia or a neuroma. So these really aren't the same injury. We're just talking about midfoot pain, like in between those bones, on the bones. This could be anything like a stress reaction, stress fracture, neurologic irritation, neuroma, Morton's neuroma. All those things are typical names, diagnoses for what we really probably should just call foot pain, because when we try to name the thing, the tissue, it gets really hard to treat because people start owning that.
So some common treatments for metatarsalgia or forefoot pain are cortisone injections, which we want to be a little careful. We want to be a little careful with those because it's really surface. It's a pretty thin area right there and it may cause more irritation than good. NSAIDs, so anti-inflammatories, metatarsal pads that you wear in your shoe, which means that you have to wear a shoe 24/7, and orthotics.
Yeah. So some better options for treatment than those, and sometimes those are necessary. Sometimes cortisone injection will knock down pain. Sometimes an orthotic is a temporary platform to change function. In this case, a stiff foot is far worse than a mobile foot. And you would think a wiggly foot that can run into the ground would show up with some sort of like bony pain or metatarsal or interdigital pain. But really when you have a stiff foot, you're running into the ground with all this impact. So what we want to try to do is loosen up that first foot. So this could come down to drills like our plantar flexion sits, where we're going to work on the forefoot or the dorsum of the foot, working on the big toe with dorsiflexion sits through the toe, rolling with a lacrosse ball, inversion and eversion flossing of the ankle, and then our triplanar ankle move. So just getting that foot moving overall. Then when we have a foot that's mobile, then we can work on some of the stability functions so we can control that foot when we want to with things like a short foot drill, plugging that short foot into anything like a squat, deadlift, RDL.
So metatarsals that squeeze together
Squeezed.
are typically found in, So to return back into performance after having some sort of metatarsal pain, something that you want to look at is the shape of your shoe. So a lot of shoes nowadays are pulling the metatarsals together, squishing them, compacting them. And so if you look at your shoe, you want to look at the back and you want to have a wide toe box. So you want to have something like these. So ultras are very wide in the forefoot, giving those metatarsals room to be mobile and move, just as Beau talked about before. The other thing is when we are active, we really want to focus on that tripod position, because that will allow us to distribute weight equally throughout the foot, instead of what I see a lot of times is distribution at the heads of the metatarsals, where they're really not designed to hold that amount of weight. So we want to have that nice tripod in the head of the first metatarsal, and the fifth metatarsal, and the calcaneus or the heel.